challenges. Mr. Chairman, national responses, however, cannot be fully effective unless complemented by strong international cooperation and mobilization of much needed resources. While the pandemic is primarily a health crisis, its social and economic impacts are far-reaching and devastating. It has exposed the fragility of our societies and economies to shocks, laying bare deep inequalities and threatened the achievement of the sustainable development goals. Developing countries are likely to suffer from massive poverty, unemployment, and social unrest against the backdrop of a sharp economic downturn. In view of the pandemic's socio-economic impacts on developing countries, Prime Minister Imran Khan has called for a global initiative on debt relief, which aims to seek urgent debt relief for low-income and middle-income countries. Developing countries must be supported in overcoming the massive impact of COVID-19 by providing fiscal space and financial relief to manage the consequences of the unfolding crisis. Mr. Chairman, the scale of the crisis triggered by COVID-19 must be matched by the magnitude of our response, and which must be huge, innovative, and coordinated. A holistic response to COVID-19, broader development dimensions, along with the health system challenges we face. Our response must also emphasize the importance of health security as a key component of national security, leading to enhanced investments in healthcare infrastructure. At the same time, a collective response should stay clear of politicization and pursuits of narrower agendas. These exceptional circumstances call for exceptional solidarity. Our movement has a proud legacy of upholding the principles of the UN Charter and the values of multilateralism and solidarity for advancing the common goal of sustained peace and development. These core values must remain at the forefront as we navigate the unprecedented challenges posed by the pandemic. The founding principles of our movement and our solidarity and commitment to these principles, Pakistan will continue to play its role in the efforts to fight the pandemic and its impact. Mr. Chairman, our efforts to fight COVID-19 and its impact must not remain oblivious to the dangerous trends that have ominously crept up in the wake of the pandemic. There has been an alarming increase in religious intolerance, hate speech, Islamophobia, xenophobia, and other forms of discrimination, resulting in incitement to hatred and scapegoating of religious minorities for the spread of the virus. Those targeted, especially children, women, and elderly, have faced verbal abuse, death threats, and physical attacks, and have been denied access to vital health services. Nowhere are these trends more pronounced than in our immediate neighborhood, where response to COVID-19 has been not only discriminatory but also specific in targeting of Muslims. The spread of the virus has been widely dubbed Corona Jihad by supporters of a far-right government, amid claims that the pandemic is a conspiracy by Muslims to infect people from other religions. This hate-mongering is part of ideological dispensation and anti-minority agenda that has taken deep roots in our neighborhood. Meanwhile, Mr. Chairman, the people of Kashmir in our region, who have been under occupation since 1947, have now been made to suffer under a political lockdown since August 2019. More than a year. The situation has become even more aggravated in the wake of the pandemic, where the Kashmiris continue to be denied high-speed internet, access to the world, and face restrictions in terms of medical and other supplies. The Kashmiri political leaders and a vast majority of its youth are languishing in crowded jails, making them vulnerable to the pandemic. It is unfortunate that while the world's attention has been focused in fighting COVID-19, opportunistic moves were made to alter the demographic structure of the occupied territory in complete violation of international law and relevant United Nations Security Council resolutions. Despite United Nations Secretary General's appeal to avoid war and warlike situations during the pandemic, we have suffered cross line of control heavy shelling resulting in many civilian deaths. Mr. Chairman, this unprecedented crisis can and must be transformed into opportunity to create a more equitable world economy and world order that can enable developing countries to make progress towards sustainable development goals and ensure that in an interconnected world, interdependent and increasingly globalized world, our policies and responses to such a crisis leaves no one behind. This conference must resolve that 1. All skirmishes, warlike situations must be ceased so that countries can focus on health. Number 2, that our efforts to handle COVID-19 should stay clear of politicization and pursuit of narrow agendas. Number 3, that there should be an urgent global initiative on debt relief. Number 4, that there should be strong efforts by governments to discourage intolerance and discrimination, incitement to hatred, etc. because of COVID-19 and to ensure equal health access to all people. And number 5, that a major effort with particular focus on the poorest of the world for their relief and for revival of economies must be done so that livelihoods may be restored at the earliest. Mr. Chairman, the world has a more serious crisis which loudly demands that leaders of the world should rise and lift humanity out of its misery and save the world as we know it, indeed to improve upon it. Pakistan stands ready to support you and work closely with Your Excellency in this endeavor. I thank you all, ladies and gentlemen.
Thank you, Mr. President.
नाज़रीन, गुफ्तगू सुन रहे थे आप सदर मुमलकत डॉक्टर आरिफ अलवी की, जो कि आज़रबाईजान में गैर वाबस्ता ममालिक की तहरीक का ऑनलाइन सरबराही इजलास अटेंड कर रहे थे और वीडियो लिंक के ज़रिए खिताब भी किया। इस खिताब में कोरोना वायरस से निपटने के हवाले से पूरी दुनिया को यकजा होना होगा, यकसां तौर पर मुश्तरका फ़ैसले करना होंगे और इस हवाले से पाकिस्तान ने जो इक़दाम उठाए हैं उनसे आगाह किया गया। एक तो ख़ास तौर पर $8 बिलियन का